one of the lessons that we should not forget is that in the heat of the moment, a lot of times nations and communities think that equity is a distraction. But our experience has shown is that an equitable response is a more efficient response. Our group has empirical data. We have data, and then there are other groups that have come up from a different perspective, that a standalone response to the pandemic in terms of vaccine distribution has pretty high risks. For example, if country A is fully vaccinated and the rest of the world has suboptimal vaccination, the likelihood of variants emerging that decreases the efficacy of the vaccine that country A has distributed is higher. And so therefore, we sink or swim together in this.
I've been thinking a lot more about sort of the reasons why people are skeptical of healthcare, various critics, but also the vaccine hesitants and anti-vaxxers and things like that as well. And I think you start to see over time the way in which vaccination becomes sort of, it's a very political thing. It's sort of a vessel that can be loaded with all sorts of different kinds of meaning wherever you are in the world. You see these examples of vaccination being used as sort of an ideological weapon during the Cold War, so that, you kind of get to choose between these, the kind of classic confrontation of communism and capitalism. And the one brings vaccination and the other brings, something else. The idea of aligning yourself with one or the other of those countries then becomes something that trumps the question of whether or not the vaccination itself is something you need.